The doctor is talking about brain death. And when a layman is saying that the patient is dead, they're saying that the person is lying there lifeless. The heart may be beating. If a person knows how to take the pulse, they know how to look for the respiration, they will say, okay, the pulse is there, the respiration is there. Then
Wonders
they will say that the
the
patient is,
difference between the patient just not responding and the patient who has lost the perception of the world, or the whole
yeah,
perception from the patient's perspective
yeah,
is lost. Yeah.
yeah. I think Dr. Lakshmi, for the people who are listening, you please tell them what is the difference between just cardiac death and what do you say, asystole and brain death. It's your turn now to talk.
Yeah, yes, sir. So, when the heart is beating every time during systole, the brain is supplied with oxygenated blood. And when the heart stops for any reason, due to cardiac reason, a primary cardiac reason, or a primarily pulmonary reason, or a reason from the respiratory system, which secondarily lead to decreased oxygenation and also decreased blood flow to the coronary perfusion. So again, heart stops, which is more common in children and pediatric age group. So the primary pulmonary causes where there is more cause of infections and respiratory RS is more common. So anyway, when the heart stops, the blood going to the brain is nil. So when that lasts for more than 3 minutes, so what happens is the brain damage which happens is irreversible. So if it's more than 3 minutes of cardiac arrest, then the patient goes into irreversible brain damage because the neurons cannot be revived. Once it is dead, then there is no new cell formation in the brain. Whatever number of neurons we have is fixed. So the brain goes into permanent cell damage. So after which, what happens is the patient, even if we make them survive and the patient comes back, the heart starts beating and everything is systems are getting back to form. Even otherwise, after the patient will not recover from the brain damage. The patient becomes a permanent kind of a, what to say in
Vegetative,
layman term,
vegetative state.
yeah, vegetative state.
Vegetative state.
Yeah, so where the nervous system will not be the central brain, the central nervous system goes into permanent damage, and the patient will be having the systemic circulation, everything, but patient will not be aware of the surroundings and he will not be responding. So it is difficult to go through such a